Popular remedies that can cause dementia. Did you know that some widely used medications can increase the risk of dementia? Have you ever wondered if that daily pill might harm your cognitive health? This video will explore 7 popular remedies that can potentially cause dementia, shedding light on the importance of being cautious about what we put into our bodies. This video is for educational purposes only, so speak to your doctor if you have any medical concerns. Now, get ready for a revealing video that could change how you approach your medical treatment and the preservation of your mental health. And let's get started with the first medication, benzodiazepine. Benzodiazepines, such as diazepam, which are widely prescribed for their calming and sleep-inducing effects, have raised concerns regarding their long-term impact on cognitive health. These drugs enhance the activity of GABA, a neurotransmitter with inhibitory effects on the brain, contributing to their efficacy in managing conditions like anxiety, insomnia, and seizures. However, this mechanism of action, while beneficial in the short term, may pose risks when these medications are used over prolonged periods. Studies have shown a correlation between extended benzodiazepine use and an elevated risk of dementia. The alteration in brain chemistry and potential for dependency makes it imperative for individuals using these medications to maintain open communication with their doctors or pharmacists. Additionally, another research conducted in France followed more than 1,000 elderly individuals over 15 years and found that those who regularly used benzodiazepines had a 60% higher risk of developing dementia compared to non-users. Number 2. Antidepressants. The use of antidepressants is widespread, offering relief for those grappling with depression and anxiety disorders. However, navigating their use with an understanding of potential cognitive risks is imperative. Notably, tricyclic antidepressants, TCAs, have garnered attention for their link to an increased risk of dementia. These drugs, which include amitriptyline, imipramine, and nortriptyline, among others, operate by altering the balance of neurotransmitters in the brain. Yet their mechanism of action also involves anticholinergic effects, which can impair cognitive function by interfering with acetylcholine, a neurotransmitter critical for learning and memory. Studies show that the anticholinergic effects of these medications can lead to cognitive deterioration over time. A significant study conducted by Indiana University analyzed the data from over 400,000 patients and found a clear link between the prolonged use of tricyclic antidepressants and an increased risk of dementia. The results showed that individuals who used these medications were significantly more likely to develop dementia, especially if they took high doses or for prolonged periods if you are using tricyclic antidepressants. Alternatively, other classes of antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin and norepinephrine reuptake inhibitors, SNRIs, are generally considered to have a lower risk of contributing to cognitive decline. This difference underscores the importance of personalized treatment choices in the management of depression and anxiety, particularly for populations at higher risk for dementia, such as older adults. Number 3. Anticholinergic medications. Anticholinergic medications serve a wide array of purposes, from alleviating allergies and treating symptoms of overactive bladder to addressing episodes of depression. Despite their widespread use and benefits, there is a growing concern regarding their potential impact on cognitive health. These drugs operate by inhibiting the activity of acetylcholine, a key neurotransmitter involved in learning and memory processes. This inhibition can disrupt normal cognitive functions, leading to memory problems and an eventual decline in mental acuity. Research indicates that the prolonged consumption of anticholinergics is tied to a higher likelihood of developing dementia. Given the critical role acetylcholine plays in the brain's ability to process information, the disruption caused by these medications could have significant long-term effects on cognitive health. Individuals on these medications should engage in regular consultations with their pharmacist or doctor to assess the risks and explore possible alternatives that carry a lower risk of cognitive impairment. We talked about anticholinergic medications, but did you know that statins can also pose a significant risk to cognitive health? Let's explore this medication called statins. Statins, recognized for their role in cholesterol management, have been debated concerning cognitive health. Research exploring the relationship between statin use and dementia presents a complex picture, with some studies indicating a potential for increased risk, while others suggest protective benefits against cognitive decline. The controversy arises from statins' mechanism of action, which involves inhibiting an enzyme crucial for cholesterol synthesis. This process lowers cholesterol levels and may impact the brain's metabolism, which is essential for neuron function and integrity. The brain relies on cholesterol to create cell membranes and synaptic communication, which is necessary for learning and memory. Studies have shown mixed results regarding the relationship between statin use and cognitive function, while some research suggests that statins may have a protective effect against dementia. Research published in the Journal of Lipid Research analyzed data from thousands of patients and found a potential link between prolonged use of statins and an increase in dementia cases. Monitoring cognitive function through regular assessments can help detect any changes that warrant a reevaluation of statin therapy. Number 5. Antipsychotics. The treatment of severe mental disorders, such as schizophrenia and bipolar disorder, often involves the use of antipsychotic medications. These drugs, while pivotal in managing symptoms, have been identified as a potential risk factor for dementia, particularly among the elderly population. The primary mechanism through which antipsychotics exert their effect is by modulating dopamine, a neurotransmitter integral to mood, motivation, and cognitive functions. This alteration in dopamine levels can have unintended consequences on mental faculties, potentially leading to memory impairment and an accelerated cognitive decline associated with dementia. The decision to use antipsychotic medications necessitates a careful evaluation of the potential benefits against the risks, especially concerning mental health. It is of utmost importance for your physician to consider the lowest effective dose and to regularly reassess the need for continued use of these medications in their patients. Additionally, exploring non-pharmacological interventions and alternative therapies that pose a lower risk to cognitive function should be prioritized whenever possible. Number 6. Opioid pain relievers. Opioid medications, widely prescribed for acute and chronic pain relief, have been a cornerstone of pain management for many years. These drugs, including popular prescriptions such as oxycodone, hydrocodone, and morphine, are known for their effectiveness in reducing pain. However, there is growing concern over the potential cognitive side effects associated with long-term opioid use. Research indicates that prolonged exposure to opioids can lead to changes in the brain that may impair cognitive functions such as memory, decision-making, and executive function. The risk of cognitive decline associated with opioid use is particularly alarming, given the increasing prevalence of opioid prescriptions for chronic pain. The mechanisms behind opioids' impact on mental health are complex and involve opioid-induced changes to neurochemistry and brain structure. These changes can exacerbate cognitive decline, especially in vulnerable populations such as the elderly, who may already be at an increased risk for dementia. Physicians are urged to exercise caution when prescribing opioids, especially for long-term treatment. It is essential to evaluate the potential benefits and risks of opioid therapy in the context of each patient's individual health profile and risk factors for cognitive decline. Alternatives to opioid pain management should be considered whenever possible. Lastly, anti-seizure drugs. The necessity of anti-seizure drugs in the management of epilepsy and various seizure disorders cannot be overstated. However, a concerning aspect of some anti-seizure medications is their potential linkage to cognitive impairments, including an increased risk of developing dementia. The exact pathways through which these medications might affect mental health are still under investigation. Factors may include direct neurotoxic effects, alterations in neurotransmitter systems, or even indirect effects, such as changes in blood chemistry that could impact brain function. For patients relying on these medications, it becomes imperative to maintain a vigilant approach to monitoring cognitive health. This entails routine cognitive evaluations and discussions about noticeable changes in memory or cognitive abilities. When feasible, physicians may explore adjusting dosages or switching to alternative medications with a lower risk profile. Thanks for watching. If you enjoyed this video, like, comment, subscribe, and click on the bell icon so you never miss a video. We wish you all the best for your health and well-being.